Okay, we're back, and hope you enjoyed that demonstration. I find it one of the things that are very, very useful, and I want very much for patients to talk to their providers about getting the Cologuard if you're age 50 and you meet the criteria. Very important that you understand that this test is done in the convenience of your home. It's very sensitive. If you're negative, you can rest assured you're negative. And if you are positive, then you have a slight chance, but at least you're not going to a colonoscopy in vain. You have a good reason to consider it. So please talk to your healthcare provider. This test is paid for by Medicare and most commercial insurances, and Exact Science will make sure that you are covered for the test. And the only reason they want to charge you is if you lied about the fact that you didn't have any of those tests done. Remember that there is a medical information bureau, and so every test, every diagnosis that you have is recorded in a file somewhere, and insurance companies will look at that and they will use that to charge you, because what will happen is the insurance company will deny payment for the Cologuard because you did not meet the screening criteria, and then you will get stuck with that bill, and that will not be a pleasant bill, as it is about $500 to have that test done. The FOBT kit is cheap. It's very inexpensive, but also pretty much unreliable, meaning when it's negative for blood, but it doesn't mean you don't have a small polyp that's sitting there brewing, trying to turn into cancer, and the next year it might be more irritating. And then you're looking at a more invasive procedure and a possible colectomy. So the call line is open. I know Ray had called in earlier, but the producer and I got our wires crossed. We were going to take calls in the beginning. I was going to hold calls while I did the colonoscopy issue, so the Cologuard issue. So if you're out there and you do want to call in, please feel free to do so for the call line. Anyway, one of the things that I wanted to talk about was allergies and allergy season. As you know, we're kind of into the allergies. I know I've experienced it a little bit more this year than I normally have. And it could be just a different pollen that's up there. People that move to this area a lot of times will move from wetter environments where things are not quite as green, and they get a break from their allergies. And you can see I'm a little nasally because there's something in this room that always gets my allergies up a little bit. But that being said, when you move to this area, you are going to get a geographic cure, because there are a lot of things that don't grow here where they may grow on the eastern seaboard, or they may be on the California issue. And it's constant exposure to some substances that cause allergies, meaning you don't have to be born with the allergic problem, but you do get exposed to it over time. We'll hold that thought, and we have Chuck on the phone. Hey, Chuck.
Hey, Doc. How you doing tonight?
I'm great. How are you doing?
Good. I love that shirt.
Thank you. I got a compliment on it from somebody else, so thank you very much.
Looking snazzy, young man. Hey, I got a question going back to the polyp thing. I had a colonoscopy in 2015, and they found one polyp, and they removed it, and it was benign. And my question is, that was the first one, of course, I ever had, and I'm 68 years old. So when would you recommend me having another colonoscopy?
Since it was one polyp, and that was at 68, took you that many years to develop it, I would say 5 years would be about the right time to look. I would not go longer than 7 years for sure. But I think you can start thinking about it at year 4 and trying to make sure you've done it by year 5.
Awesome. That answered my questions there.
And then after that, depending on if you have a negative, they probably, the timing on these colonoscopies is nobody likes to do them after age 75. And the reason why is risk of colonic perforation. In fact, I had a patient the other day that refused to have any testing done because they didn't want to think about possibly having to have that. And you have to understand that as the colon gets older, it does become more likely to perforate, but it is a rare occurrence. I've had it happen in one of the patients that I've had sent for multiple colonoscopies. So it is a very rare occurrence, but when it does happen, it is also very nasty. So those are the things that people, but we live by this creed in medicine, do no harm, and we take the path of least resistance, and we also want to do a specific order of testing so that if you did have that, there would have been a good reason to have it. Because nobody wants to have to defend why I went straight to bypass surgery just because you had chest pain without actively diagnosing whether or not you truly had coronary disease.
Yeah, I know all about that one.
Yeah.
Okay, Doc, thanks a lot. Appreciate it.
Oh, thanks, Chuck, for calling in.
Bye-bye.
Appreciate that, and I appreciate all the callers. I got away from, I used to prepare a lot of PowerPoint presentations to have on the show, but because we have such a great audience that calls in and asks me so many different questions, never really gave me a time to really, I do a lot of work to prepare it, but never really got through it because I was too busy answering questions, which is what I would rather do, is answer your questions and try and put it in a way that you can understand it and help you figure out what may be an issue or may not be an issue for you. So back to allergies, becoming sensitized to something over time is usually how we develop allergies. The first year, maybe no exposure. Ray's called in. Ray. Let's see for Ray. Ray
the Flagman here. You were talking at the beginning about different insurance and papers and how it used to be. A little story from Chicago. I was born July 13, 1944, and the doctor who delivered me was Frank Duplessis. Well, in the 70s, I needed to see a doctor, and my brother Bob told me, see Duplessis, he's a two-banana doctor. Well, I didn't know what this meant, but I went for an office visit and talked to the guy, and we conferred for a while, and I said, how much do I owe you? He said, 2 bananas, $2. And this was back in about 72 or 73. So he was from the old school. You know, we all know the old school burnt down years ago. But
right.
This was really something to see. Frank Duplessis, I just wanted to share that with you.
Yeah, that's good.
I want to ask a question. A lot of people I'm talking to now, I ask them a question about panic attacks, and people have these things all the time. I'll bet you a lot of the listeners would be interested to see what it's all about. I've seen 2 cases in court over the last 2 or 3 weeks. One guy was in custody. He was in a suicide suit. He attacked the guard. He just couldn't stand being in the courtroom. He threw the guard against the wall and big scuffle and everything else. He was having a panic attack. He couldn't stand to be in the courtroom. He had no place to go. He was shackled, leg and hands, and yet he just couldn't realize that he couldn't stand it. The second one was where a guy was sentenced for not paying a fine, and he pleaded with the judge to give him 30 days to pay the fine. It was a fine of $390, and the judge kept saying, no, this is a drop-dead date or whatever. When the judge sentenced him to 3 consecutive 90-day sentences, that's 9 months, the fellow had a seizure, and he went to the floor and kicking and foaming, and the gurney came in, and they took him out and everything else. I don't know if he was having a panic attack or what, but just a mere pressure of a thought of going to jail. So if you can talk a little bit about panic attacks, I'm sure a lot of the listening audience would be interested in it. And thank you very much. I'm always glad to see you on TV.
Yeah. Thank you, Ray, for calling. So, you know, panic and anxiety is one of those things that, you know, plagues a lot of people all the time. And so a lot of times people get a lot of different symptoms. They may not know they actually are having a panic attack. They may just feel something similar to their hands becoming sweaty or They feel an extra heartbeat, all the way to pure agoraphobia, where they think the world is going to end and impending doom. Most of these are mediated by adrenaline to some point, which is a natural flight or flight reaction. But those people that have true anxiety, they can't help it. And what they unfortunately have is a deficiency of a certain neurotransmitter in their body called GABA. GABA is a depressing neurotransmitter. So you can imagine that you have a balance system. Those excitatory neurons and excitatory hormones like adrenaline and things of that nature, and then you have the depressing neurons, GABA. And so Valium was developed a long time ago, and it's a pure GABA medication. And so when you take someone that has pure anxiety and you give them Valium, that releases and that corrects the imbalance that those patients have. And if you talk to them, they're nothing as simple as like, I'm perfect. I can go do what I need to do. I can get out. I don't have this feeling of impending doom. I don't get tired. I don't suffer the consequences of that. Well, I'm going to hold that thought for just a second because Louis called in, but after the break, I'll pick up the anxiety and I'll pick up Louis' call. Hey, Louis.
Hey, Doc, how you doing?
Good.
Listen, I got a question now. Me and my wife take a lot of vitamins. Are there any vitamins, like if you take too many or you take certain ones, that they have an adverse effect where one would work against the other one? I've never really heard anything bad about vitamins, but we take a lot, and I was just wondering if there was any kind of a problem, if certain ones would cause a problem with other ones. So that's my question.
Sure. That's a very good question, Louis, and I'm going to we're going to go to break, so hang by the TV, and I'll get to that after I finish Ray's question. But
okay, thanks a lot.
You're welcome. And then if I don't answer it, you can always call back after the break. So if you give someone that has true anxiety the neurotransmitter replacement medication, Valium, they live normally. They're not going to sleep, they're not doing anything, they just feel like they are normal. And that's really the test of that. Since Valium, they've come out with a lot of other derivatives of the parent compound. Some act shorter, some help you with sleep. Restoril, temazepam, anything that ends in that AM is a derivative of Valium. And so they all do the same thing. They all correct it. I mean, someone who gets anxiety about getting on a plane, Xanax would be appropriate because it's a very short-acting anxiolytic. They don't have the true endogenous deficiency of GABA. They have a situational anxiety, just like going in public speaking or doing something in that nature. That's a situational anxiety, more fitted for a very short-acting. So we have this level of consciousness, and I want you to hold that thought. I'll be right back. This is our baseline, and when we get anxious, we go up, and we take something, we come down, and when we get off of that, we go above that. We'll hold that thought, and we'll be back after the break. Thank you very much.